All right, everybody, welcome back. This is our second live show, and as you can see, I am not in Florida. So as you can tell by the clothes I'm wearing, the somewhat cloudy day we're having. I am in beautiful Park City, Utah, and I am very excited to be joined by my very good friend, world-class clinician, and extremely well-dressed man of the hour, Dr. Robert Sanchez. How you doing, Robert?
I'm excellent, sir. Thanks for asking, Mark. Good to see you.
And I really appreciate you joining us. So
Of course.
when it comes to behavioral health, there really is nobody who knows more about this stuff than Robert. And I have been pretty open about the fact we're getting a little bit of feedback, Michael. FYI, it's echoing. What if that's at your? I've been pretty vocal.
Dr. Sanchez, do you have headphones?
I do not
Okay.
on me. But I
Okay,
can
well-
mute myself if you'd like during his talking. I can do that.
Well, we're going to go back and forth. We're going to do the best we can. Well, I love these technological challenges. Some of them don't teach the lawyers and clinicians. So we're good. We're good. But when it comes, I've been pretty vocal about my opposition to marijuana. And when it comes to that topic, I shouldn't say that's not fair. There's definitely nobody who knows more about that topic than Robert, partly because we work so many of these cases together where we see these individuals coming in who are so far down the proverbial rabbit hole of psychosis, we wonder if they're ever going to recover. So I wanted to get him on here to challenge me and tell me why we shouldn't go back to making marijuana illegal across the board for both recreational and medicinal purposes. So, Robert, what do you think about that? Should we just say no marijuana to anybody?
Yeah. So first of all, thanks for having me and thanks for the question. What I would say is that, it's legal in 24 states recreationally. It's legal in 40 states recreationally and medicinally. But I don't think that just making it illegal across the board is necessarily going to answer our questions. We tried that with the Volstead Act, which took place from 1920 to 1933, and it really didn't resolve the challenge. There was an initial drop of about 30%, but then it came roaring back, and it just created a black market for alcohol, and we all know how that experiment turned out. So I think it's much more about classification, oversight, and sort of putting some sales limits on how it's distributed. I also think that looking at the age verification system and getting some good data, right? Data is going to help us make better decisions about how to do this. But the challenge is, of course, as we've talked about many times, Mark, that cannabis of the 80s and previous times was about 3 to 5% concentration in THC, and now some of the concentrates are anywhere from 60 to 90. So it is no longer the same substance, and because there are some challenges as it relates to classification oversight and some data-driven pieces, I think that it's more about instituting that than just saying we're going to make it illegal across the board. That's my opinion.
Yeah, I grew up in England. I was a child of the 80s, and I had a lot of friends who smoked marijuana. And for the most part, they all went on to have, successful, productive lives. So when they talked about legalizing it in Florida, I said, that's not going to be any big deal. They'll make a few bucks. Hopefully they spend it the right way, and no big deal. But I definitely could not have been any further from what was really going to happen here, is that we have seen so many of these psychosis-driven cases fueled by marijuana. So, I mean, is there a connection between marijuana and the psychosis that we're seeing in so many of these cases?
Yeah, certainly. The drug itself has changed because of the consistency of the psychoactive ingredient, which is THC. So the challenge is that we've seen a really strong uptick. Some studies say upwards of 300% upticks in the case of cannabis-induced psychotic cases, especially with vulnerable populations like males between the ages of 18 and 25. We think that has to do with the neuroplasticity and development of the brain. But the challenge isn't there are a number of ways that this can be addressed, because you could also argue that about 8 to 10% by most research studies are in pretty much agreement that that's about the prevalence rate of alcoholism. What we're seeing with cannabis addiction, cannabis-induced psychosis, and cannabis-induced mood conditions such as depression, anxiety, that those numbers are beginning to touch about 20%. So about 20% of the population that are using cannabis with regularity and using it consistently, we are seeing these challenges. So,
Okay, so one of the questions I get asked by parents when they call us, they say, "Well, you know, he's got a card, she's got a card, so well that must mean it's safe." So does the fact that there's some right when we say it's legal, right? Does that mean because somehow the government has blessed it that makes it any safer? And if not, what do we do to change that?
well, it's a great question because you could say the same thing about prescription drugs such as benzodiazepines that have addictive properties, opiates that have addictive properties. They are legal if they are prescribed appropriately by a licensed and accredited physician. But that doesn't make it any safer, right? Because we know that the propensity for addiction and for mental health is very much based on the individual's constitution. And so just because something is legal doesn't make it safe. We would ask that parent, well, if alcohol is legal, does that make it safe? Or because someone has been prescribed a certain medication that may be contraindicated because they have a propensity for addiction, does that make it safe? And so the answer across the board is just because something is legal, it certainly doesn't make it safe. What I would say is to your question about what is our answer, if we do look at alcohol and we look at even FDA regulated substances, there's a lot more checks and balances. And we saw what happened when we didn't have checks and balances in the late 90s and what happened with the opiate epidemic. But what I would say is that we have to start thinking about this differently. And one of those things has to be oversight from a government level, which is to say, who's watching all of this? Right now, it's pretty
Nobody.
loose. Nobody. Second is there has to be a classification system so that if someone is buying cannabis on some label, like anything else that you buy in the way of an FDA regulated drug, it has to be placed on the label so that people know what they're ingesting. The other thing I would suggest is that there would be some system to have possible side effects. I don't think that someone's going now to their local cannabis store, Mark, and it says one of the possible side effects is psychosis. It might make a difference in A, if they're willing to do it, B, and how they do it. Because what we're seeing is 60 to 90% concentration. And if you use that substance every day, and incidentally, cannabis is a fat soluble drug. So the problem is it has much higher concentration, readily available. It's being used around the clock. And because it's fat soluble, it is stored in our fat cells for approximately 30 days. So you put all those things together, and what's happening is people don't understand why this is happening, but there are some clear data points as to why and a clear path forward to make it safer for everyone.
Okay, so I've heard, and correct me if I'm wrong, that from sort of 0 to 25, a young adult's brain is still forming, right? It's still
Correct.
a thing. So
Generally accepted. Some argue a few years more or less, but yes, that is generally accepted. Yes.
So, sometimes what we'll see is that somebody started to use marijuana in high school, right? And then things started to progress. So is there sort of a window of time somewhere between 0 and 25 where they shouldn't be allowed to use? And after 25, it's probably a little safer. And I use the word safer very loosely.
So it's true that we are seeing higher incidence and prevalence rates specifically with males between the ages of 18 and 25, to your point. I do think that having age limits would certainly help. But I'm not sure, Mark, that any one of these things is going to just fix the problem. Because if we were to approach it that way, we would say, well, you're in most states of the United States, not all of them, but most, you can't drink until you're 21. But does that mean that people under the age of 21 don't drink? Do it all the time. And does it mean it's changed the prevalence rate of alcoholism in our country? Not really. So what's important is, again, some sort of oversight classification system and educating people about what the possible effects are. So to your question, if we said, okay, we're going to cap it and no one under 25 can purchase cannabis, would that resolve the problem? It wouldn't, because we are seeing cannabis induce psychosis, depression, and anxiety across the board. That's just the highest. That's sort of the highest risk group. They are the group that is at highest risk. But it doesn't mean that we're not seeing it with 30-year-olds, 40-year-olds, 50-year-olds. We've even seen it in geriatric populations. So that in and of itself would be a measure or a tool that we could use. But would it totally quail what we are seeing in the way of the cannabis-induced psychotic conditions, depression, anxiety, and what I think is that we are in an epidemic? Would that fix it? No. And here's one more thing I'd like to add, Mark. I don't think that any one piece or any one sort of factor that we've discussed is going to be the answer. It's going to be a multitude of factors working in concert. And incidentally, some of those things are being talked about, but I don't know that we're going to have those sort of systems in place before this thing gets away from us, if you like, meaning that it's already on fire across the country, and you know that because you two deal with this on a regular daily basis, as do we.
Yeah. So if we're not going to sort of get rid of the vice, and I think that you pointed out, obviously, years ago when we tried to get rid of alcohol, it just sort of backfired. Is there a way we can sort of cap the concentration? I mean, we cap the concentration of alcohol in alcoholic beverages.
Yeah.
So could we do the same, say, with these marijuana products to make them a little safer? Would that reduce the risk of psychosis?
I think that's a great point. And absolutely, we know that the concentration along with route of use and how often it's used are playing a significant role in whether that patient develops cannabis-induced psychosis, cannabis-induced anxiety or depression, and other conditions. So yes, I think that if we regulated it, classified it, and possibly put a cap on how much concentration a particular substance has in the way of THC, would that help? I absolutely think it would. And I think that it has to be about, it has to be 6 or 7 things coming from a multitude of angles. The way that we regulate food in this country, the way that we regulate FDA in terms of medications, as well as alcohol. I think it's a great point, and it should be considered and looked at. But to your earlier point, there's been very little done in any of these areas. And so I believe this is going to be an ongoing challenge.
Yeah, I read a really interesting article a couple of weeks ago, and they were saying they think there's a connection between people that smoke marijuana as opposed to the edibles and vaping and other stuff and lung cancer. And they're sort of equating it to, people that smoke cigarettes, developing lung cancer. And now they're saying there's the same connection with smoking marijuana. So is there a version of marijuana that would be safer than, say, smoking it? Does it make a difference? It's all bad.
It would depend how we define safer. Clearly, anytime you put any foreign substance in the way of smoke in your lungs, whether it's cigarettes or cannabis or smoking any substances, including vapes, then clearly you're going to have a higher propensity for not just lung cancer, but any sort of pulmonary conditions and diseases. And not only those conditions, other conditions like cardiovascular conditions, circulatory conditions. So you're right. Is it safer from the perspective of lung health and general health if you were taking edibles versus ingesting it in the way of smoke? Clearly. But the problem is that sometimes the edibles and some of the other items have such high concentration and people just eat them around the clock that is where we are seeing the challenge with cannabis-induced psychosis. So the question is a bit loaded. From the perspective of lung health, overall health, yes. But if you're taking edibles at 60 to 90% concentration, you're just more likely to end up. And I'm not saying that if you smoke, you're less likely. But from a health perspective, yes, you're right. If you're not smoking something and the ingestion route is that through edibles, is it better for your lungs? It is. But the question is, and this is the question we'll be asking for a while, how is it affecting the brain? Now, one other quick point I think that's important is how drugs are metabolized and get to the brain. We know that substances that are smoked, as a general rule, reach the brain faster. So the reason most people choose to smoke, for those who do, or take edibles for those who do, is because if they smoke cannabis, they receive the effects faster. It comes through a different route, right? It's picked up in the circulatory system through the lungs and delivered in that way to the brain. Whereas if you take edibles, it has to go through your digestive tract, go through the first pass effect through your the portal vein and your liver, and then redistribute it into your body before you're going to see effects. So it's a great question, but it does have a multitude of answers. Now, if we asked a pulmonologist, he would say, of course, of course, it's better if they take it through edibles. But I think there are other issues in terms of what is it doing to the brain and how is it affecting people's daily functioning. But those are my thoughts.
Yeah. Michael, we have a question that was posted. Do you want me to do those now, or do you want me to do them at the end? Let's do it now. So the question that was asked is, if people are going to use it anyway, why make it illegal? Doesn't regulation make it safer and helps medicinally? I think that's a great question. What do you think about that? I mean, if people are going to use it, because listen, when I was a kid in the 80s, there was no legal marijuana, so the kids bought it from whoever had it on the streets. And even if we banned it, I mean, I think the question that's posed is a good one. Even if we banned it, it's still going to be available. People are going to still use it. So if we've got this, legalize it and we regulate it to make it safer. What do you think? Great question.
No,
Thank you.
I couldn't agree more, Mark. Again, I want to go back because we've done this about 100 years ago and some change. From 1920 to 1933, the Volstead Act made alcohol illegal, and all it did was change the course of how people were able to buy it. It created a black market for it. Did it fix the problem? Did it stop alcoholism during that 13-year stretch? And the answer to that is no, it didn't. On the contrary, it made it more difficult. So I'm in agreement with this person that it's better if what we are going to, if it's legal, then the best way to kind of approach some of the challenges is to have some regulation, classification, and some oversight, not only from the government, but from healthcare systems as well, to start gathering data that we don't have because it's not regulated or classified. But I think that making data-driven decisions in how it's classified, age groups, concentration of THC, all the things we've talked about working in concert. The problem is that none of that really is moving. There have been some grumblings and conversations at the federal level of the government to kind of look at some of this, but I think that we are far away from getting to a place where it's better regulated. But I agree that it would be best to create these systems of oversight, regulation for the public safety versus just making it illegal. I agree.
Yeah, the other part of the question is, and I think it's Connor, and helps medicinally. That's a really good point. So a lot of the argument for legalizing it was, well, there are certain medical conditions, I think cancer being one of them, that it could help. And of course, what happened was we legalized it for medicinal purposes. And somebody walks into the doctor and says, "Oh, I have really bad depression." Like, okay, here's a script, and then they go fill it. So are there legitimate reasons for having medicinal marijuana, and what medical conditions would it apply to if we're going to use it?
Listen, there's for a long time, and as well, that during cancer treatments and conditions such as glaucoma, we have known for many, many years that cannabis does have some good efficacy, and there's good research to show that it can be quite helpful in terms of symptoms and patient pain management. So you get no argument out of me that it certainly can be used if used responsibly, like any other substance, and it can help in certain ailments and certain conditions. I think the challenge is that because the regulation doesn't match that of the FDA with other sort of medications also used for symptom management, that's where the challenge lies. So for example, if you have someone who's very responsible, they don't have functional impairment in areas of their life, there's no mental health predispositions for psychosis, depression, anxiety, and there's no mental health predisposition for addiction, and the patient has specific medical conditions, do I think that it is a resource that can be used for certain patients? I absolutely think so. I don't think it's any different than somebody who has a propensity for addiction, has a a legitimate chronic pain condition, but has to be careful with the type of opiates they use, because they too can fall into a position where they become addicted, even though they started innocently with a pain condition. So I think it has its place medically, but I think that, like anything else, some of the oversight, classification, and responsibility of the providers and the patient being transparent are keys to how it's used and when it's used effectively.
Okay. Well, thank you for that question. It was a good question. All right, let's switch gears for a second, because I know that when we see some of these cases, we use the word, medically induced psychosis. And perhaps we see it so much and we use the term so much, I don't even know, at least because I'm not a clinician, that I even stop and think about what it means. We're dealing with the parents and who have an adult child, for the most part, living in a different universe.
Yeah.
So maybe you could shed some light. When we talk about, marijuana-induced psychosis, what do we talk about? What does that look like from the patient's perspective?
So if you're talking about cannabis-induced psychosis, there's a couple of things that are important to remember. One is that whoever does the assessment on the patient really does need to consider all of the other factors in ruling out other etiologies or sources, if you will, of psychosis. So, for example, if somebody has a traumatic brain injury, can that cause psychosis? Yes. Are there certain thyroid conditions that can mimic psychosis? There are. So we have to be careful when jumping straight to that conclusion and making sure everything else is ruled out. From the perspective of mental health, does this person have a predisposition to have a psychotic condition? And you may say, well, that's great. How do you measure that? You look for substantiated diagnostics in the family history. Has anyone else in this family suffered from schizophrenia, schizophreniform, schizoaffective disorder, bipolar disorder with psychosis, or major D with psychosis? If the answer to those are positive, then there's always a chance that the cannabis just acutely exacerbated an underlying condition. But assuming, Mark, that we've ruled all those other things out best we can, and with proper medical care, clinical care, then certainly you would say, okay, this seems to be cannabis-induced psychosis. What does it look like? Well, it looks like any other psychotic condition where somebody used cannabis for a period of time, we rule out the other conditions, and they're experiencing they're experiencing hallucinations and delusions. That essentially is what psychosis is. So all of your five senses that you have plus delusions. Talk about that for a minute. Hallucinations are just basically a person feeling that they're experiencing something in the absence of stimuli. So they hear things that aren't there, see things that aren't there, smell things that aren't there, feel things that aren't there. And so when there's nothing in the environment to stimulate what that looks like, that by definition is what a hallucination is. Typically, you're going to hear about people. The most common type of psychosis of hallucinations are auditory, where people are hearing bells or voices or whatever they may be. But I've seen all types. From the delusion standpoint, and I want to be clear because some people think that, oh, he's delusional because we use it in everyday language. Delusions essentially mean that the person has thoughts that are not rooted in reality. So if you're having an argument about this, that, or the third, and no one can really prove your point for or against, that's not really a delusion. But if someone believes that their phones are being tapped without evidence as such, or even more extreme delusions that the Martians are taking their thoughts through the lights, so we need to turn the lights off so they can't take them, that would be what delusions would look like. One more quick point is that when we talk about cannabis-induced psychosis, one of the measures we have to consider is functional impairment. We can't just say, well, they're experiencing a thing or two and the parents aren't sure. We have to look at all of the other areas of functioning. How are their relationships with their wife, children, or the family of origin members? What are they doing vocationally? Are they able to function in day-to-day life socially? We need to address those issues as well. That is going to give us a better idea of the level of psychopathology with any given patient.
Okay, so once we've diagnosed somebody as having psychosis, what does the treatment protocol look like, and how long does it last? I mean, you know, some of these cases are challenging, both clinically and legally.
Yeah, it's a great question, and it has no single answer, except that the first thing you would do in a case of cannabis-induced psychosis is try to separate the person from the cannabis clearly. That typically is going to entail some residential program, a PHP with housing program, to separate them from their environment. It doesn't have to mean that, but it means that most of the time. Second thing is once the medical team has assessed the patient, ruled everything else in or out, they're going to address it in the way of an antipsychotic medication because cannabis-induced psychosis is not treated any differently than any other psychotic condition, barring that the etiology is believed to be or the hypothesis is based on the data that it's being driven by cannabis would be step one, separating them from the cannabis. Step two, making sure that there's a good regimen of antipsychotic medications. To the latter part of your question, what does the timeline look like? This varies from case to case. We've seen cases where they get on an antipsychotic regime and they clear up in a month. And we've seen them take as long as 12 to 18 months to clear up because the psychosis just keeps fighting back during the course of treatment. So it varies from case to case.
And would some of the treatment involve some type of medication to stabilize?
Yeah, so when you get the person into a residential facility, the medical team is usually going to put the patient on some sort of antipsychotic medication regime. Yes. There's sometimes complicating factors, like the person may have had a pre-existing condition to have anxiety or even a diagnosed condition of depression. So they're going to treat all of the mental health conditions, but like anything else, it's usually in cases like you're describing, the psychosis and the functional impairment that land the patient in treatment, and the antipsychotic regime is administered like any other. However, one of the key factors with good medical teams and good facilities is they'll continually reassess the patient. There's the initial assessment, sort of the separation from cannabis, the introduction of antipsychotic medication, and then monitoring the patient daily, closely under good nursing care to see what effects, if any, the antipsychotic medications are having.
Yeah, was it 2 weeks ago now? You and I were both speaking at a conference, the Veritas conference. And if you don't know what Veritas is, what the Veritas conference is all about, you need to Google that, okay? 'Cause it's truly amazing, and I was honored to be a guest speaker. But one of the things that you talked about was the fact that sometimes getting somebody out of psychosis can take a period of time, which you talked about, but it can only take one use to suddenly snap them back in. So it takes time to get out, but going back into psychosis can be a very rapid process. Talk about that just for a second.
Certainly. Thank you for the question. What the research is indicating is that once somebody has become psychotic, this again is assuming that everything else has been ruled out and it's thought and believed, usually by multiple treatment team members, that this is cannabis-induced psychosis. Once it happens once, because of neuroplasticity and because of the way that, so let me explain this quickly. The reason that we think that cannabis is causing this psychotic induction, if you will, or this in the cannabis-induced states, is because it is dysregulating the dopamine system, which we know is what causes psychosis. Excess dopamine causes psychosis. So to your question, when people leave treatment, even if they're on antipsychotics, if they begin to use cannabis again, they typically get back to the psychotic state much faster with much less use needed. And it also is harder. It's harder to treat the cannabis in the second round of treatment. So to your question, if somebody gets out or leaves early or doesn't complete treatment or does complete treatment and uses cannabis shortly thereafter, they are much more likely to become psychotic again. And the second round of the treatment of that cannabis-induced psychosis becomes much more difficult.
Okay, an interesting point. Okay, one last thing before we wrap it up. There has been some talk at the federal level of reclassifying marijuana. Shed a little bit of light on that and tell me what you think about that. Because that had always been the sticking point for the states, right? They couldn't even take credit cards because under federal law, right? I mean, it was, even though they were allowing the states to get away with it if they want to, I'm going to start, closing all these places down. They didn't, but now it looks like things are changing. What do you think about that? And talk about the reclassification for us.
So I think it depends on how we define reclassification and how they're going to go forward with this. But as I said in the beginning, I do think there is space here to have some government oversight, and have at least a classifying system, which we don't have. If somebody buys edibles in Colorado or California or wherever they may be, and they buy it in another state, in Connecticut or Oregon, you can't compare apples to apples because there are no labels saying this has 20%, this has 60%. And so I think that there is oversight and reclassification needed in order to sort of control and really educate the general public about what they're consuming. That hasn't happened. So do I think that should happen? I think it will help with some of the epidemic that we are seeing now. And again, I've said it before, I'll say it again. I believe we are already in a cannabis-induced epidemic. And I think that is one part of many parts that are going to be examined. To your earlier point, age limits, I think, are important. I think educating the general population about what they are ingesting, and the same way we do with other FDA-regulated medications. So I certainly think that there is a place for reclassification. I think it will be contingent upon the specifics of the laws and how they're applied. But I do think it's an important piece as we begin to deal with the conditions that we are seeing around the country with cannabis-induced psychosis.
Okay, we have one other question. This is I think really applies to the kind of work that you and I do.
Sure.
Is how do the parents even get any kind of control when the adult child won't cooperate? I mean, this is our wheelhouse. So I'll let you go first with the clinical piece.
Sure. So in instances where, and they'd have to give me a little bit more, but assuming that they can't control, let's say, the patient's ingesting of cannabis, if that's what the question is referring to, the first thing that I would always recommend to a family is, get professionals, whether it's a psychiatrist locally, a therapist locally, start getting him or her connected to professional services. If they're unable to do that, there are really good people around the country that work with families every single day to get them into treatment. People that work with families, that do interventions, that do placement liaisoning, including ourselves, and good people around the country. And also keeping in mind that if you're in the state of Florida, and if you're not in the state of Florida, there are ways to do that as well. But if you're in the state of Florida, there are a bunch of really good laws on our books that help families in such a situation. And I'll let Mark elaborate there.
Yeah, I mean, you and I talk all the time about, because most of the people that we work with, and the people typically are the parents, they're not in Florida, right? So their loved ones are either here, they're coming here, or we're figuring out how to get here. There's two very good reasons to come to Florida. Number one, we have phenomenal treatment here in Florida, and you and I work with just a handful of those facilities. But two, we've got some laws down here that are really unique to Florida. And what they do is they give a family the authority, the ability to make the decision that their loved one cannot make because of the behavioral health issues they're dealing with, which is the decision to go into treatment in a clinically appropriate facility and stay there long enough and comply with medications and giving the families access to their medical records. And if we obviously restrict ability to travel and control finances and decide where they live and who they spend time with, those are the types of things that we can do here in Florida. Plus, we had an amazing task force that cleaned up our industry a couple of years ago. And especially in South Florida, our judges, even the lawyers that work in our space, they're incredibly switched on to the work that we do, and they all seem to understand the goal here is to save the family by saving the patient, because if you don't save the patient, the family gets destroyed. It's like a metastasized cancer. So that's just a great question, but that's a bit of a softball, but I'll take it. So listen, before we go, Robert, would you tell the viewers how do they get in contact with you? How do they find more about the incredible work that you and your wife do?
Yeah, they would just go to axiomhealthservices.com, and there's our contact information. We're happy to talk to any family in any way we can, even if they don't bring us aboard or retain us. We're happy to collaborate and provide resources to families. We believe that is an important part of this work, and certainly it's important for families to know what resources they have and in which direction to go. Sometimes I find just getting the families some of the information gives them some relief, but we're happy to help in any way that we can.
Great, thank you. And for the folks that are watching, if you want to learn more about what we do, go to mentalhealthaddictionlawfirm.com. That's mentalhealthaddictionlawfirm.com. Or just do a quick Google search for Mark Astor. I think we now have about 930 videos on YouTube,
Wow.
giving families the information they need, talking a lot about how the legal work that we do and the amazing clinical work that Robert provides all work together, because it does take a village. And if you can get the legal and clinical combined, then you have a really great chance of getting success. If you don't, then things become difficult. And we know what happens when things become difficult. So for the folks that watch, the folks who are going to watch on the replay, thank you for watching us. And we'll see you next week. Take care. Bye-bye.